We're doing our Theraband flow. I would ideally use a thinner Theraband because a thicker one's just going to be too much. So if you get your Theraband and then come and line your back. So, you see me, right? So if you lie on your backs, so again we'll start with connection, posture and breath. So start with your feet hip distance apart. Okay, so we're going to work on connection first. So we'll just go through the points where you should be feeling connected, and then once we've done that we will work on how to get better connected. So you should be feeling it underneath both your feet, underneath your lumbar sacral junction, so the junction between your lower back and your pelvis, underneath the TL junction, so your junction between your upper back and your lower back, both shoulder blades and the back of the head. Okay, so we'll start with the feet. So we're just going to shift the weight from side to side. So we're just trying to shift the weight so that we become a little bit more balanced from side to side. And when you feel like you've got that balance, if you just pause there, and then you're going to think about where you're feeling that connection on between your feet and the floor. So are you feeling it on the outside or the inside? So whichever way you're feeling it, we're going to try and get a bit better connected. So if you're feeling it on the outside, we're just going to try and bring that inner arch towards the floor, keeping the outer arch on the floor so that we keep a neutral ankle. And if we're feeling it more on the inner arch, we're going to try and pull the outer arch down without lifting the inner arch. Okay, so once we've got our feet, we're going to work our way to the lumbar sacral junction. So we're going to start to rock the pelvis backwards and forwards, so into anterior and then posterior tilt. As we take the pelvis into a posterior position, the lower back's going to move down towards the floor, and then as we go into anterior, your spine's going to peel away from the floor. So rocking between anterior and posterior tilt. Okay, so once you feel like you're in the midpoint between the two end ranges, you're going to stop. So you'll have a nice neutral spine, nice neutral pelvis, your lumbar sacral junction will feel better connected with the floor. And then we're going to work our way up to the TL junction. So think of the rib cage and pelvis like the pages of a book. So we want the pages to be closed, we don't want them to be open. So we're going to try and pull the pages together so that the ribs and the pelvis are parallel with each other or on top of each other, to try and get away from this lumbar extension and rib flare appearance. And with doing that, you'll feel better connection between your TL junction and the floor. So now work your way up to your shoulder blades. So that wants to feel equal from side to side again. So you're just going to shift the weight from side to side until you're feeling a little bit more balanced. And then thinking about the shoulders, so making sure that we're not in an elevated, anteriorly positioned and internally rotated shoulder. So we're going to pull the shoulders backwards slightly towards each other, and then into external rotation and depression, so trying to pull the shoulder blades towards the back pockets. So that's going to get the shoulders into a more neutral position. Okay, then we'll work our way up to the back of the head, so we're going to look up towards the ceiling and we're going to push the head straight back down towards the floor. Try not to let the neck extend and try not to tilt the neck downwards. So we're keeping it neutral, pushing the head straight back towards the floor. Okay, so once we've got our connection, put one hand on the chest, one hand on the tummy. We'll just work on getting the breath in the right order. So as we breathe in, the hand on the tummy wants to lift. And as we breathe out, the hand on the tummy wants to lower. You alright, Dawn?
Sorry.
It's alright. What's your dog called?
Romy.
Oh, Romy. Is that the puppy?
Yeah.
Oh.
She's just very intimidated.
They wanted to join in. Okay, so get your breath in the right order. So get yourself back in the right position. Get your breath in the right order. So you're going to breathe in and your hand on your tummy is going to lift. Breathe out, hand on the tummy is going to lower. Breathe in through your nose and out through your mouth, through pursed lips, like you're blowing through a straw. Okay, so once your breath's in the right order, we're going to put the hands around the waist. And we want to feel that expansion the whole way around, so that 360-degree breath. So your fingertips will be at the front, the web of the hands around the sides, thumbs into the back. Try not to let the shoulders push forwards when you're doing this. And we want to feel that expansion the whole way around, equal from front to back, from side to side. So if you're struggling to feel that, which you guys shouldn't be now, you should be all like pros at this, but just in case you are, you're going to cough. Feel that expansion the whole way around, and then use that as a bit of a guide to wake your brain up, to let your brain know where your muscles are. And breathe and expand. Nice, smooth, controlled movement. So you're not just sticking the belly out as you do it. It's a nice, smooth expansion. Okay, so once we've got the 360 breath, we're going to work on the brace. So it's an outward push. It's not a clench or a tense, or you're not sucking your belly button in. So we're breathing 360 degrees. Before you take the breath out, you're going to create a little outward push. So create that feeling that you feel when you're about to fart. That outward push. And try not to let the muscles completely relax as you're breathing out. And try and keep those muscles activated now throughout the breath in and out. So we're brace breathing. Do a couple more breaths. Okay, so grab hold of your Theraband, and we're just going to hold it between the hands first of all. So we want to sort of actively try and separate the Theraband. So we're activating through the rotator cuff, and we're just going to take the arms back, trying to keep the ribs and pelvis in connection. So we're going to go back as far as we can without the ribs lifting. and then bring it back down, and then back into flexion. If you get to a point where your ribs are starting to lift, you're going to breathe 360, and on the exhalation try and get the shoulders back a little bit more. Keep activating through the shoulder girdle. Backwards and forwards. So the more that you activate through the sort of external rotators and depressors as you're taking the band forwards and backwards, the less likely you'll be to get that kind of clunk. So I was getting a little bit of a clunk with my left shoulder, so just activate through those muscles a little bit more. And it's now not clunking as I bring my arms down. Okay, so you're going to stop with your arms above your head with the Theraband. So in shoulder flexion, so keep those shoulders active. And we're going to lift one leg and lower. And lift the other and lower. And alternating legs. Keeping those shoulders active. So you might ache a little bit more after today's because you're using resistance. That's fine. Don't worry if you are a bit achy tomorrow. You might feel like you've worked a bit harder, a bit more fatigued later on as well, so don't worry about that as well. So alternating the legs. And then we're going to create your 360 breath, create your brace and lift both legs and lower. And we're lifting and lowering, keeping those arms above the head, keeping the shoulders active. Just do a couple more. Keeping the pelvis neutral, try not to let the pelvis tilt forwards. Okay, bring the arms down. We're going to keep the legs up in the 3-month supine position. Okay, so now put the Theraband around both feet and in between the both hands. So it's kind of like in a rectangle shape now. So up into both hands and around the bottom of both feet. Point the hands up to the ceiling. So you're not kind of gripping hold of the Theraband. So the wrist is staying straight. And we're just going to take one arm backwards and take the other arm backwards. You might not be able to go very far. Just do a couple more. Cross the band over, hands pointed to the ceiling, and then just extend one leg and extend the other leg. Try and keep the hands pointed towards the ceiling. alternating legs. Might feel it burning in your shoulders at the minute. Let's do a couple more. Okay, give your shoulders a little bit of a shake off. Keep it crossed over, and then see if you can take, actually no, don't cross it over, just have it like the rectangle again, and see if you can take alternating legs and arm. Again, you probably won't be able to take it too far. Let's do one more. Cross it over again, and then we're going to point the hands to the ceiling, and we want to lift the head slightly, and we're just going to roll to one side and then roll back, roll the other way, roll back, roll the other way, keeping control of the body. Try not to let the pelvis and shoulders disconnect. And then we're gonna go on to one side. Going to come up into your lower oblique sit, and then you want your hand in the Theraband. So get both hands into the Theraband like this. So put it behind you, and then it goes in between the thumb and the first finger. Okay. So forearm down on the floor, and we're going to just keeping that body nice and straight. We're going to reach with the opposite hand and then rotate round. Be careful with it pinging at your back. So like it might just like decide to come up like that. We don't want that to happen, so keep it nice and controlled. So we're folding on the hip, folding on the shoulder, so we're hinging and then opening up. Try and keep the wrist neutral if you can. And then come up into high oblique sit. And again, we're going to do the same. So we're going to bring the hand round and up. And fold in. Trying to create that rotation in the hip and in the shoulder. Keep the shoulder active, try not to let the shoulder collapse. And then come round into your high oblique twist. Try and get the Theraband behind the shoulder blades. And we're just going to do some sort of scapular pushes. So what you want to do is you're going to push the floor away. So we're trying to push the band backwards, and then try and let the shoulder blades come together, and then push away again, and let the shoulder blades come together, push away, shoulder blades, and push away, and shoulder blades, push away, shoulder blades. And then we're going to go back down into low oblique, and then come back onto your back into the 3-month prone. Again, the Theraband wants to be underneath the shoulder blades, so I just need to put it there. And we're just going to do some scapular reaches and scapular pushes again. So reaching up to the ceiling with the hands. And back down. Reaching up. Wrists neutral, fingertips pointed to the ceiling. So pushing up towards the ceiling, reaching, and then lowering, reaching, lowering, reaching, lowering, reaching, lowering. One more. And then you want to roll onto the opposite side, up into your lower oblique sit. And then turn around. Okay, so again, keeping it in the hands. Ooh. And we're going to do some rotations. So we're reaching and then round. So we're hinging on the hip and the shoulder. They're a bit fiddly, these Therabands. Let's do a couple more. Up into your high oblique sit. Readjust, and again we're going to come round and up, round, keeping the shoulders active, don't let them collapse. Do a couple more, and then back into our high oblique twist. Get the Theraband over your scapula, and again we're going to push the floor away and let the shoulder blades come together. Push the floor away, shoulder blades together. Keep doing that. Can keep activating through the shoulders. Don't let the shoulders lift and don't let them come in to anterior position. Couple more. Okay, come up into your tall oblique sit. Keep the Theraband in your hands if you can, and we're going to rotate the knees up to the ceiling, and again going to try and reach with the Theraband and back, reach and back, If you do need to have a little break from the Theraband, that's fine. You can still do the movements without the Theraband. Let's do a couple more. Okay, and then just pop the Theraband to the side a second. So we're going to just rock from side to side. And then what we're going to do is shift the weight to one side so it'll lower into that knee. We're going to lift the pelvis and come round into quadruped. And then come back and round and into quadruped the opposite side. Back. Try and make sure your pelvis and shoulder moves at the same time. Controlling that movement. Side to side. And then finish off in your quadruped, down into low quadruped, and then we're going to go into 4.5 month prone. So from low quadruped you'll take one leg straight back. So my right leg's gone backwards, so my weight is shifting into my right forearm and hand and my left knee. So making sure that you are not falling and collapsing into lumbar extension and into an anterior pelvic tilt. So we're lifting, so we're pushing the floor away with that knee and the forearm. Grab hold of your Theraband. You might need to wrap it around a few times. And then we're going to put the hand in the opposite side and we're just going to rotate up to the ceiling. Try and keep the hand on the floor if you can, but my hand being, because this Theraband's it's quite tough, so it lifts your hand off the floor. These Therabands are better, but I wanted to use this one because most people are probably using these ones. Okay, so rotating up to the ceiling, hinging on that shoulder again. And then swap sides, so bring that leg back, drop the other one back, swap hands with the Theraband, keep the shoulder active, pushing into the floor with the forearm and the knee, and then rotating this side. Do a couple more. Really nice shoulder activation. Bring that leg back into your low quadruped again. So we don't need the Theraband for this, so we're just going to do some finding neutral spine, making sure the upper back's nice and long and in that extended position, so it's not rounded, it's not flexed. Keep your shoulders active, so Pull the shoulders back and down. And then we're just going to hinge the hips. So hinging backwards. Hinging the hip, not rounding the lower back. And then come forwards. And back. Forwards. Just do a couple more. Come up into quadruped, and you're going to put the Theraband behind your back. So again, in your hands, so in that sort of web of the hand. So into your quadruped, find your neutral spine. Make sure your upper back is nice and long, neck long. And then we're just going to do some hinging backwards again. And forwards. And back. Hinging at the hip. And the shoulder as well. And then come into quadruped, and we'll do some scapular pushes again. So we're going to try and push the floor away, separating the shoulder blades, and then pull down so the shoulder blades come together, and push away and down, push away, down, push away, down. Let's do one more. Okay, and then we're going to do some shoulder flexion. So this one you'll have to be a bit careful as well, because otherwise if you go too fast it'll just ping off your back. So again, just controlled movement, get it in the right place on your back. So take one arm forwards, other arm forwards. Careful it doesn't ping up your back like that just did. That's how not to do it. And then if you can, sure you can, we're going to just start to do a little bit of a crawl. So keeping the band where it is, you're going to take one hand and one knee forwards, other hand, other knee forwards, one hand, one knee backwards, other hand, other knee backwards. But keeping the spine nice and straight. So the spine doesn't, the body doesn't move. This movement's coming from the extremities. So forwards and backwards, 2 steps forwards, 2 steps backwards, 1 more forwards, 1 more backwards. Put the Theraband to one side because I think bear's probably a little bit too much at the minute for the Theraband, because I don't know about you, but my shoulders are already a bit fried. So we'll just do the bear without the Theraband. So find your neutral, push the floor away with your with your hands, making sure that the shoulders are nice and active. And we're going to lift, curl the back feet under, create your brace, and lift your bum in the air, knees off the floor. Bless you, whoever that was. Lower down, lift, lower, lift, lower, lift, lower. So we might need to take a couple more breaks with this. So lower down, give your shoulders a shake off, give your legs a little shake. And find your neutral again, upper back nice and long, neck long, curl the back feet under, lift the bum, and then we're going to hinge the hips backwards and walk the hands back into your squat. If you can, before we stand, we're just going to try and take the arms up overhead, so grab your Theraband again. And we're pulling the band apart and lower it down, up, down, up, down, up. Keep the band in the air, stand, find your neutral, and back down into your squat. Nice and controlled, up and down. And then if you put the band underneath both feet, squat down a little bit to put it behind your head, behind your neck. Find your neutral, create your breath, and then we're going to just go down into a squat and back up. Again, find your neutral, down and up. So up and down in your own time, making sure you've got your neutral pelvis each time. Nice upright spine as you're going down and back up. Okay, take the Theraband away once you've done your last one. Go back down into your squat. Hands down. And walk your hands back out. Take one leg forward into your tripod. Get your Theraband again. Behind your back. Into your hands. So your hands are on the floor. And then we're just going to do some hinging backwards with the Theraband this time. Keeping the upper back nice and long. So trying to pull that upper back into extension. Try not to let the upper back round. Feeling that stretch down the back of that front leg. Keep focusing on your breathing as well. Forgot to tell you about your breath. Just focusing on your 360 breath as you're doing it. Okay. And then come up into your high kneel. Actually, no, sorry, before we do the high kneel, and go back into your tripod. And we're just going to do some, this might be a little bit long, so you might need to fold it over a little bit. And just do some rotations. up to the ceiling. So you want to turn into the front knee. So I think you're doing it right there.
I think I was the wrong way enough.
Oh, right, you've corrected it. Let's do a couple more. Okay, up into your high kneel. We won't use the Theraband for this one. We'll just do a normal high kneel to stand. So get your pelvis neutral, pelvis level with the floor, curl the back foot under, shift the weight forwards and stand. And then take that other leg back, slowly lower down, pelvis completely level with the floor. Oh, I'm just noticing what Niam's doing. So, I like that. Grab hold of your Theraband. Keep on that knee. You're going to separate the Theraband, so pull it apart. Stand. And then lower and turn into it. And back round. Stand. Back. Lower. Turn. Let's do a couple more. Really slowly lowering down. One more. Okay, hands down. Pull that leg back into bear. Take the other leg forwards into tripod. Theraband behind your shoulder blades again. Onto the floor. And we're just going to hinge backwards and forwards. Again, hinge in the back. Not hinge in the back, sorry, hinge in the hips. Keeping the back neutral as much as you can. Only go as far back as that back knee allows. So if it's sore, don't go too far, just get to where you can. A couple more. Bring the band round, hand into the Theraband, and we're going to do those rotations again. So up to the ceiling, keep that shoulder active, hand pushed down into the floor. Feel that rotation through the spine. Do a couple more. Up into your high kneel. Pelvis level with the floor. Neutral pelvis, neutral lower back. Foot not too narrow, so bring the foot to the side. Get the Theraband again, pull it apart. Hinge or lean into that front knee and stand. Take that leg back, slowly lower down and turn into it. And stand again. Down, turn, stand, turn, just do a couple more. Last one. And stand. And we're done.